I talk with Deogratias Niyizonkiza, founder and CEO of Village HealthWorks, an organization delivering quality health and education in Burundi. Deo explains how resources that can change the world are not lacking, but they are often misutilized. We talk about the unnatural barriers between grassroots innovators and funding institutions, and how he has seen a lack of trust in local people to define their own solutions. He advises never listening to anyone who tells you that your dream is impossible. We hear about hope even in the direst of circumstances, and how insurmountable challenges can be overcome. How sometimes even mortal enemies can become collaborators and even friends. Let's listen. We've asked some of the social development leaders in the sector about some of the bumps in the road they've faced and really the lessons learned from those and how they've moved past them. I'm here with Deogratias Niyizonkiza from Village HealthWorks. Deo, I'm obviously very familiar with your incredible story and how you got started and the comprehensive work you now do that I believe started driven by health, but you guys are expanded into education and comprehensive services. But in doing this work and dealing with the practical realities on the ground and the political realities surrounding you, I'm sure you've had many challenges and times where it seemed you're at your most difficult and maybe it even seemed insurmountable. I'd love to hear from you maybe about some of these times when you've reached your hardest points, what those were, and maybe some of the ways forward that you've discovered.
Thank you, Jordan. First, it's great to see you, and I'm so pleased to hear how these questions, and I was thinking about it. Well, at Village HealthWorks in Burundi, we have had so many bumps. I cannot tell you how many days for so long and how many times I said it to myself, what the heck was I thinking when I got myself into this? And it's very hard first being in between worlds. A world that does not understand at all the great potential that we have in Burundi. And what is that Burundi? It's a country that has been completely off the map. Today you hear about Burundi, and it's really interesting. This is the first time there's a country called Burundi is in the news, unfortunately for the bad, not for the good. But it's good at least that people are becoming aware that there is such a thing called Burundi as a country. That's a beginning. And I think some of the people I have been meeting, had the opportunity to meet, it has given me the opportunity to say, look, there are people over there who would love to have a life like everyone else, like our own children and relatives who are the most privileged to be, say, around here in New York City or in the United States, by accident of birth, and they have everything. And when I'm in Kigutu, exhausted by the lack of, for example, funding to build a classroom for the children who are so beautiful, who are wondering what life has to offer, and to be part of the world, not just Burundi. But none of this is happening. And so it's so frustrating for me to have to spend months and years to explain it to someone who is capable of not only helping to build a classroom, but build a school, because it doesn't cost that much. And it's not expensive, because what is expensive is the lack of education of the children who are part of the world. And if we don't pay attention to these issues, when we don't have any big window of opportunity to actually educate our children, create a dignified environment where they can grow and have curiosity and happy life, it's hard. So it's so frustrating to me, because what we are doing at Village HealthWorks is really confronting the problems that exist there, and we know how. we know how and we know what it takes. And we get so overwhelmed by people saying, it's not sustainable. You cannot do that when they haven't been in those environments. What it basically means is that we don't trust you if we don't know it. How come that you know it when we are actually there? So that is extremely frustrating. It's so demoralizing, so discouraging, but giving up has never been our solution. Every time we are with these children and these mothers who have lost family members and the children, the joy they show us, they smile more than anyone else I've met here in New York City or, who has everything. And they give me hope. They give me the desire to continue to work with them. So you have the bad and the good. But also, it's so frustrating to be in a country, as you know, that went through hell on earth, war for over a decade, and children who were born in the jungles, in the refugee camps in different countries, in the camps, or internally displaced camp. Those children today, they are in their 20s, they have known no normal life. And so the other ones who were in their 20s like me back then are in their 40s, and they didn't really get the right education. So these are people who are actually the workforce of the country. And what kind of skills do they have? So this is how we miss the opportunities, but they try very hard. They know exactly what they need and how they can support the vision and the mission of Village Health Works. And so that is very frustrating, but the good news is that we have people we can talk to in the United States, in Europe, or outside of Burundi, even within Burundi, some of the luckiest ones who have these skills. Talk about the importance, the value of the work we do, the mission, so that they can jump in and train whoever can be trained. So these are frustrations that we get, some of many.
Sure. So you speak of the frustration of the difficulty of acquiring funding to support the work in a way that truly supports your mission, and the misunderstandings that are common amongst potential funders. So I'm wondering, we were speaking before about giving pledges and about Mark Zuckerberg giving $45 billion. If you were able to advise somebody in that position, somebody who could give away that amount of money, what are some of the things that you've seen that are barriers to the effectiveness of this, and what would you advise?
It's a great question. I have been thinking myself about that, as you and I discussed a number of times, and others. The issue is not that the resources are lacking. It's how they are utilized, and it is a shame that they have been so misutilized. And it's the route, it's the channel, it's all the different policies that we have created. And by the time we reach the real issue, there are no funding. I would, for example, why are some institutions like the World Bank unable to support directly grassroots organizations, NGOs? They have to go through some other institutions, and we are doing the work that everyone is talking about, the UN, Millennium Development Goals, Sustainable Development Goals, but there are all these barriers. So someone who has, like Zuckerberg, who has this wonderful idea that I'm going to spend 99% of my money on philanthropy, it's important to know what the real program is and who actually is suffering from these problems. As my people in my community say when they're doing volunteer work, they said, well, look, we are poor, but we are not stupid. We are not poor because we are lazy. And it's important that the donor community, the founders, started really thinking seriously about reaching out to the children and educators in the schools and the community members to ask them the questions about what do they want, and if there was some help, what kind of help do they need? And also feel it and explore it, and trust people like you who has dedicated your life at Ubuntu Education Fund. What are the challenges? Versus going to the South African government, not that, one thing doesn't exclude the other. But it's important to double check and see what are the really issues. If you hear a country, for example, like Burundi, it doesn't have to always be, oh, hey, President, what is going on here? Of course, it should be that way, but it doesn't prevent Zuckerberg, for example, from going to a rural village of Kigutu to ask the rural community members, what are your challenges? So as a grassroots organization, as a member of a community like Ubuntu Education Fund, we often feel that we are suffering, we are doing everything we can to honor human dignity, to uplift and bring decency in the communities that are in the news, but those news are just created by people who actually are not experiencing the challenges that they're experiencing. And so what's wrong with us? Or what's wrong with people who can help actually in not opening the doors to hear the stories from the people on the ground who are doing great work and who are experiencing a lot of sufferings that are so preventable and needless.
Absolutely. And now I want to ask you a separate question. We've talked a little bit about the frustrations of philanthropy and the advice we could possibly give to those philanthropists who want to make an impact, but also for those who are thinking about getting involved in social change, as you have. Obviously, your story is incredible, and you are a doctor, a medical professional, and you were driven by your own experience and your own understanding of people's needs to get involved. But when you first got involved, and you didn't even truly have an organization behind you, you were just one person trying to make a difference. What were some of the earliest mistakes that you made that maybe you could share a little bit, so that those who are attempting to do the same things that you've done, those who have dreams of getting involved the way you have, can learn early and yeah.
Yes. I think I have lost count of the mistakes I made, but I knew that there were going to be expected challenges and unexpected challenges. I started the Village Health Works with a big vision and zero money. But I also knew that if I don't start mobilizing the local community members who were suffering to make bricks and build whatever they could build, so that we could have a shelter that patients can get in, and I can bring my friends from hospitals here in the US and physicians and nurses and others. These community members were going to disappear. And I had seen so many people dying. It's so hard, Jordan, to watch a mother die in childbirth. It's so hard to hear stories, for example, this wonderful mother who came with a child so sick, fever, shivering, and she's helping to build the road that links the main road to the capital city and the village where our hospital is. She said to me when I asked, why are you bringing this child who is so sick? And she said to me, don't worry. I know this is the only child I have and it's going to die. I have lost 4 children. I have no hope that my child you see here is going to make it. Instead of watching him die, I would rather go out and make my contribution by digging, making this road. Hopefully, it will help someone else's child. And we have so many stories like that. And you know what is possible. So I didn't know how to build a hospital, for example. I didn't, by the way, speaking of that road, if we had the technicians, the road is now 6 kilometers, but if we had the technicians, they could have really measured and figured out the best way. It would be probably 2 kilometers. But because we didn't have the skills or anyone, that was bad. And then we built this hospital, cutting bushes and the trees and all that, and we end up spending quite a lot of gravel and construction materials. If we had a surveyor, if we had someone to really help, we probably would have saved some money, which we didn't have. Thank God we were actually relying on our own hands and all that. Also, many challenges. Probably we could have been able to talk to different people and sit down, but it was really, who were skilled, but it was very hard because hardly anyone was buying it. In fact, a lot of people were telling me, you must be crazy. How are you going to do that? This is just a pipe dream. Okay, now I know that even if you can save one life, that life matters, and that life can save a village, can save a country, and can save the world. So I had a lot of people telling me, it's not possible. You are just wasting your time. And I ended up dealing with these ideas instead of thinking, overwhelmed by people, instead of thinking, how do we get there? And instead of getting more people to actually jump in, I end up feeling so isolated in internalizing all this stuff that I didn't talk to some of my friends, even what I was going to do, because I was afraid that people are not actually going to help me, are going to tell me how crazy I am and how impossible this is going to be. So you know when they say a failure is an orphan and a success has 1,000 fathers. It's unfortunate that people tend to come to join a cause when it's shining. And there are very few people who are brave enough to say, okay, here we are on a flat land, but we have this mountain to climb. It's steep. When you are still on the flat land, everyone is there dancing and playing, but climbing is going to be hard. And so we've been climbing. And the more you climb and the longer the mountain is, the less people are going to be around you. And some, in fact, can actually be so overwhelming that you just feel you should be on your own and climb alone instead of wasting so much time. So there is lack of trust, belief in what you are doing, in the vision, the mission, and yet you know how important the idea, the vision is to prevent suffering, to save lives, and to strengthen communities, empower communities. So these were my challenges in the beginning, and we were working in a country that was still at war, in a country divided into ethnic groups, where even though the root causes of these problems really have to do with the social living conditions that have dehumanized this country. And so bringing people together was not easy. But I was quite surprised, happily, by how former enemies not only became collaborators, but friends, and how they united around this small, beautiful organization which they own, Village Health Works. And it was very difficult for people who do not know Village Health Works, haven't been there, to believe that. In fact, most of the people who are supporting us had to actually go there to see what it was and say, God, we had no idea. So trust the people who are on the ground and who are doing the work. And the travel, don't be afraid, because fear is our worst enemy. It's convincing people that this is the right thing to do and it's possible, and stop wasting your time telling me how impossible a thing is, it just is, we can do much more if everyone buys into it. And these are the challenges I think we still face today. To not trust. It's not the resources that are missing. It's the lack of understanding and the compassion that is being challenged.
Well, Deo, I think that's incredibly valuable, and I'm not surprised that we can certainly take inspiration from the challenges that you experienced, inspiration and wisdom from challenge, which a lot of people might consider insurmountable. But I think summarizing what you said, it's that these insurmountable challenges are sometimes just the inspiration we need, and we can't give in actually to what are perceived as challenges. I want to thank you very much for your time, and thank you for joining us on Failures from the Field.